Our next update on men's health and wellness involves a sensitive topic, the bent penis. In many men, the member may present with a slight bend or curve when erect, but in some cases, the bending is quite severe and can be a source of distress for men who have to deal with this often painful issue. A more precise idea of how the penis works can help them to understand this condition and make informed choices if medical treatment is necessary. To start, it's helpful to know a little about basic penile anatomy. Inside the penis are 3 cylinders, 2 of which are basically twins and are called corpora cavernosa, which means cavernous bodies, and a third, much smaller cylinder known as corpus spongiosum, which lies underneath the corpora cavernosa. All 3 of these cylinders are composed of a very spongy tissue. In addition, each of the corpus cavernosum are lined with a thin layer of tissue called Tunica Albuginia. It may help to picture a hot dog. The outer skin casing is like the Tunica Albuginia, while the inner meat of the hot dog is like the corpus cavernosum. When the penis becomes erect, the spongy tissue of the corpora cavernosa absorbs an increased flow of blood, which causes them to expand and harden. The Tunica Albuginia contains a fair amount of elastin, which enables them to expand as well, so they can keep up with the expansion. How does this relate to a bent penis? In situations in which a man possesses a significant bend or curve, a man may be diagnosed with Peyronie's disease. This condition may cause pain and/or problems with function. Sometimes the bending may be severe enough that a man is not able to engage in penetrative sex. Peyronie's comes about most often because scar tissue has developed in the penis. This frequently happens when there is trauma to the member, such as getting hit in the groin by a baseball, or it may be due to repeated small traumatic events, such as frequent rough handling during sex or masturbation. Very often, the scarring takes place in the Tunica Albuginia. The scar tissue is part of the healing process after trauma, but scar tissue does not have the same elasticity that normal tissue does. When there is too much scarring, it overcomes the natural elasticity of the Tunica Albuginia. When an erection starts to form, the side of the penis with scar tissue cannot expand as much as the rest of the penis, so it causes the organ to bend. In addition to causing a bent penis, this scarring may prevent the corpora cavernosa from filling up with as much blood as they would otherwise, and this can result in erectile function challenges as well. So, what are the treatment options for Peyronie's disease? If a man has a severely bent penis, he should seek medical attention, especially if it causes pain or interferes with his sexual satisfaction. Sometimes a bent penis resolves on its own, but when it doesn't, there are several medication options that may be tried. In some cases, surgery may be suggested to remove the damaged tissue. Men are advised to consult with their doctors about the most appropriate treatment options. Thanks for watching. See you next time.